start today with Mayor John Cooper. Then we'll hear from Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force, followed by Brian Hassett, President and CEO of United Way of Greater Nashville, and Butch Spiriton, President and CEO of the Nashville Convention and Visitors Corp. Dr. Michael Caldwell, Metro's Public Health Director, and Chief William Swan of OEM and National Fire Department are also here with us to help answer questions. One administrative item, those of you who are connected on the WebEx program, you'll see a small raise hand button next to your name. If you'd like to ask a question over the air during our Q&A session, please click that button at any time during this event, and we will unmute you as time allows to ask a question of our speakers. And with that, we'll start with Mayor John Cooper.
Thank you for joining us this morning. As the coronavirus situation continues to evolve, it's important to provide everyone with timely and updated information as regularly as possible while maintaining good social distancing practices. So I appreciate the media's cooperation as we switch to this new daily format. Nashville is famous for our world-class hospitality and entertainment scene, and the warm welcome that everyone receives when they come to visit our beautiful city. We're known as Music City, in part thanks to the dedicated individuals who keep the spirit of live music and good times throughout Davidson County. Now that's why I am thankful to all the bar and restaurant owners across Nashville who have moved effectively for public health and safety and for the health and safety of their employees. Now, today I want to thank Brian Hassett and the United Way of Greater Nashville for helping us set up the COVID-19 Response Fund. Also, former Senate Majority Leader Bill Frist for his leadership in this community-wide effort, and Butch Spiriton and the Nashville Convention and Visitors Corp. in getting the first $1 million in contributions to launch the fund. The COVID-19 Response Fund is an important resource that will help our neighbors who are experiencing lost wages or those who become ill from the virus, for them to receive assistance that they need to stay in their homes and keep food on the table. The fund may also be used to help small businesses facing hardships. We hope to build on this excellent effort and find even more ways to provide relief for Nashvillians affected by the coronavirus in different ways. Now, I want to say a moment that seniors do need to follow a very strict social distancing protocol and call 311 or 211 for any assistance, including meals. Now, I'd like to thank both Dr. Jahangir and Dr. Caldwell for their good work, and particularly to all our area hospitals, healthcare providers, and frontline healthcare staff as we get our assessment centers and coronavirus hotline up and running, which Dr. Jahangir will discuss in more detail. The decision to declare a public health emergency and place restrictions on our hospitality providers is serious. It has an effect that Metro government, along with our community partners, is taking steps to address. But these are strategic short-term solutions, but they will make a tremendous long-term difference in flattening the curve and stop the spread of coronavirus in our community. So to everyone who is keeping their distance from others, practicing good hygiene, and staying informed of the facts around coronavirus, thank you. Your decisions are making a difference in our community. And with that, I'd like to turn this over to Dr. Jahangir. Thank you very much.
Thank you, Mayor Cooper. Good morning. Let me start by giving you the latest update on the spread of COVID-19 in Middle Tennessee. Today, we have a total of 46 confirmed cases in Nashville-Davidson County. That is an increase of 21 over the past 24 hours. The patients range in age from 11 to 73 years old. Of the confirmed cases, 2 are hospitalized. The other 44 cases are self-isolated at home and have mild and manageable symptoms. We expect the number of cases to increase as testing increases. Commercial lab testing continues to expand, and the results show just that. Just like other cities, we are seeing some limited community spread. Most of the current cases are linked to either travel or a cluster of cases from a known exposure. I cannot emphasize this enough. The best way to limit spread is to do the following. Wash your hands regularly, stay home if you are ill, clean your work surfaces and common areas, and practice strict social distancing. Over the past few days, our COVID-19 task force has created a plan to help flatten the curve of the virus and ensure that the people of Nashville are informed and safe. It has 4 parts. Number 1, to keep the public well informed. Number 2, to launch an assessment process for residents who are worried that they may be sick. Number 3, to work closely with our area hospitals to ensure that they have the resources they need. And number 4, to mobilize our citizens to fight back against the virus and take personal responsibility as possible. Here are the details of each of these parts of the plan. First and foremost, we are raising awareness, making sure that the people of Nashville are informed each day about the status of the virus in our city, steps we are taking to mitigate it, and what they can do to help. Each day, we will hold daily briefings to update Nashvillians and answer questions. Also yesterday, I'm proud to announce that we launched a website, covid19.nashville.gov, that is dedicated to providing timely information to the public. This site will give the latest on the disease and other information like the status of metro and community events. We are updating this site in real time, and it will be one source for the latest information on the virus. Next, we're launching a community assessment system for residents of Davidson County who are concerned about whether they have been contracted COVID-19 virus. This process has 3 steps that we are asking Nashvillians to follow carefully. Step 1, we will have an assessment hotline that residents could call if they are feeling ill. A healthcare professional will answer your questions and will answer your call and your questions. If you're exhibiting symptoms, they will direct you to visit a community assessment center or contact your personal doctor, and this is step 2. In partnership with the 5 health systems and the medical schools in our city, we are setting up 6 to 9 community assessment centers across the country that will be staffed by personnel from our local hospitals and medical schools. At these centers, residents will be assessed further, and if determined necessary, will be given a test for COVID-19. We will have more detailed locations for you soon. It is critical that everyone follows these steps closely to ensure that the process moves quickly and that those who are sick receive attention first, and those who are not sick are not brought next to somebody who is sick. The health department is also working closely to ensure that our local hospitals have all the resources that they need to care for our sick efficiently and effectively. This coordination is happening at all levels of these organizations, from the chief executive officers to senior leaders to frontline providers. We are in daily communication about resources available, as well as discussing best practices to care for these patients. We are fortunate in Nashville to have the finest healthcare system in this country, and we have seen why over the past few days. HCA TriStar, Meharry Medical College, Nashville General, St. Thomas Ascension, and Vanderbilt University Medical Center have all risen to the call of Nashville with an unprecedented speed and skill. We're immensely grateful to them and all our medical personnel who are working closely on the front lines. We are also working closely together and are going to support them. However, we cannot do this alone. I have to say, I also have been working very closely with Chief Swan and the Office of Emergency Management in this process. Lastly, and most importantly, we must have the coordination and help of the people of Nashville to fight this fight. Every citizen has a responsibility to help flatten the curve and slow the spread of this disease. We are a city that supports each other in difficult times. Without question, this is one of those times. We must rise to this challenge and make this short-term change that are necessary for us to all return to normal life. It may not be convenient, but it's actually not that hard. It's as simple as following the instructions you've probably heard already. Stop going to crowded places, limit your groups to no more than 10 people. Maintain 6-foot distance from others whenever it's possible, and don't shake hands. Wash your hands as often with soap and water. If soap and water is not available, use an alcohol-based hand sanitizer. Cover your mouth and nose with a tissue when coughing and sneezing. And stay home if you are sick. By changing your behavior and encouraging others to this day, you will be playing a critical part in stopping the spread of the virus and flattening the curve. This is a challenging time. We are working quickly. Thank you for helping us flatten the curve. We continue to need your support and patience, and we will continue to provide you new information as quickly as we have it. I will now turn it over to Brian Hassett of the United Way of Greater Nashville. Thank you very much.
Thank you, Doctor. And thank you, Mr. Mayor and the City Council for your support of the COVID-19 Response Fund, which we formed yesterday. We are working with the nonprofit, business, religious, civic, and government organizations in our community to address the needs of people affected by the virus. We know our initial task will be to help people stay in their homes, pay their bills, and put food on their table. We anticipate having a short form for the direct service providers that we anticipate utilizing, like the Red Cross, Salvation Army, NeedLink, Martha O'Brien Center, Conexion, so that they can request funds from us immediately. Senator Bill Frist is chairing the committee that's been formed to address these needs. That committee meets today at 2 p.m. For anybody concerned about how to get help, they can call 211 or 311, and they will be directed to the services that are available. You can also go to unitedwaynashville.org for information about the virus, the response fund, the committee, and how we will deploy resources to help our neighbors in need. We are very grateful to Butch Spiriton and the Nashville Convention and Visitors Corp for making the first major gift to this fund of over $500,000. Butch is actively fundraising to help us with this. We are fortunate to live in Nashville. Nashville is one of the most generous cities in America and the world. We always come together, and we will come together to fight this virus. It's my pleasure to introduce Butch, and please, if you need help, call 211.
Thank you, and thank you, Mayor, for initiating and leading this relief effort. Unprecedented is a word that has described Nashville's hospitality industry over the last 10 years. Well, let me use that word again. We are in an unprecedented time. We built the success that we've enjoyed as a community, and we will respond to this crisis, this virus, as a community. It's a critical time to lead. It's a critical time to care for our community, and it's a critical time to remain calm. The situation is larger than any one entity, and we need everyone's cooperation. We believe the hospitality industry will likely be the hardest hit, but we also know everyone is affected in some way. That's why we're joining this relief effort in pledging the first $500,000 to provide relief intended for everyone and targeting individuals who need assistance. Prior to this, we've been raising money for tornado relief. We're reaching out to our donors that have already given, in addition to the $500,000 that we have provided, and asking them if we can redirect some of that money, this effort as well. We think there's another $100,000 to $300,000 that we may add in addition to the 500,000, and we hope to have that answer today. I encourage everyone to contribute if you have the wherewithal. Large or small contributions make a difference. And as I said, we're all in this together. Appreciate your support. Nashville Strong is a real term, a real phrase, and it's how we're going to get through this. Thank you.
Thank you, everyone. We will now start the Q&A portion of today's event. As a reminder, please click the raise hand icon next to your name on the WebEx program if you'd like to ask a question. As time allows, I will go off camera and call your name, which means that you have been unmuted and you can proceed to ask your question. Ian Jong with Tennessean.
Thanks, Chris. Yeah, just a process question here for everyone. Can you explain, why the numbers for the results that are being shared aren't broken down by private or non-state health lab results?
So the question is why the results are not broken down in private versus public lab results. In short, I don't know if they'll add any more value, frankly. I think what is important for us to share is the number of people in Davidson County that have the virus, age range, and to make sure we emphasize the importance and be as transparent as we can with the importance of social distancing and so forth. So that's why we have not shared that information to this date.
Meg Garner.
Hi there. We have seen in other cities an increase in kind of restrictions, whether it's shopping malls or construction sites. Do we anticipate rolling out additional restrictions in Nashville in the days to come?
Good morning. It's Dr. Michael Caldwell. We're looking at it. We've seen tremendous voluntary cooperation with the restrictions we've already put in place. People are going well beyond that, and we'll be looking carefully to see if additional restrictions are warranted. Thank you.
Tosin Fakil, I'm sorry if I'm mispronouncing your name.
You did pretty good, Chris. I was just wondering, for the response fund, how quickly will distribution begin for people to be able to get what they need? And does the 211 or 311 number help people in getting more information about how to go about if they can qualify for those funds? And this is Tosin with News 4, by the way.
Yes, this is Brian Hassett. We anticipate distributing funds as soon as later this week. The committee meets today. 211 is 24 hours, 7 days a week, and it will direct people to the providers in the community that are already set up and are dealing with tornado victims. We plan to ramp up the effort, fund them as quickly as possible to meet the needs as they develop.
Hi, I was actually just wondering if you could tell us how many results are pending, how many tests or how many patients have pending results, and where the clusters are that you talked about earlier.
There are many hundreds of tests that are being done, so I cannot give you a specific number of how many are pending. As soon as results are made available, we'll be providing those to you on a daily basis with the distribution of ages, as well as to try to also provide you information about what people that are hospitalized so you can understand that. And can you repeat the second part of your question again?
Yeah, I was just wondering if you could tell us where those community spread clusters that you've identified are.
There is no particular cluster. We believe that it is throughout the community and that we are all at risk, and that's why we're taking the actions to assure that everyone throughout the community complies with these regulations. If we get more information, we'll give that to you. Thank you.
Anita.
Hey, good morning. Anita Wadwani with the Tennessean. My question is about nursing homes and assisted living facilities. Is Metro in touch with those facilities, and do you have any specific advice you're giving to them or to visitors?
Thank you for that question. Yes, so the nursing home and assisted living population are those who are most vulnerable, and I'm most concerned about those, as we all are. We all know someone who is living there, and we all should be concerned. So I am leading a team within the task force specifically on this issue with the nursing homes and assisted living facilities. We are assuring that they're following the CDC guidelines, and we are working to identify if they have any specific needs that we can fulfill. Thank you.
Looks like that's all the questions we have for today. Later today, a video recording of today's press update will be made available to everyone, and all the members of the media will receive a link for tomorrow's 9:30 video conference. Thank you, everyone, for joining us.